Hi, this is Dr. Perry Wolk-Weiss, your Central New Jersey chiropractor, with you today from the Get Well Center in Bound Brook, New Jersey. I'm with my patient Anand here, and he's here because he was having some lower back pains. And what I wanted to talk to you today about is not so much the lower back pain, but how the feet influence lower back pain. And we're going to talk about orthotics today. And orthotics are devices that you put in someone's shoe when they have what we call pronation. And pronation is where the foot goes flat. So what I'm going to do today with Anand is we're going to look at his feet, and I'll show you what pronation looks like, and we'll talk about how it has an influence on the lower back. Most people think about bending and lifting and twisting and other things they do that can hurt their lower back, but they don't think about their feet and their relationship to the lower back area. In fact, if the feet are a problem, they can also impact the knees, the hips, as well as the lower back. So Anand, tell me a little bit about how often you were running before you came in here.
I used to run, I've done about a couple of marathons. I used to run pretty much about 25 to 30 miles a week. But then there was a point where my lower back pain started, could be because of my wrong running habits, lack of stretching. But then I came to a point where I couldn't even run a mile before I came in here. So after I came in here, after a couple of treatments, I definitely improved. Right now I'm doing about 5 miles a week, slowly improving. Definitely the pain has subsided a lot. So very good improvement.
Good, good. Yeah, and one of the things I found in Anand, when I examine him initially when he comes in, I do a full posture check on all my patients. And one of the things I look at is from the feet all the way up to the top of your head. Everything's involved. And I found with him that his pelvis was out of alignment. So not only did he have a problem with flat feet, but also his pelvic bones were out. And when your pelvic bones are out of alignment, it's like walking around with one shoe on and one shoe off, which means when you're running, it's magnified even more. So we're going to take a look at his feet a little bit and examine it, and I'll show you exactly what we look for when we do a foot exam. All right?
Okay, thank you.
Okay, so we're looking at Anand's feet, and the way we start is we look at the patient from the back. And what we want to look at is the Achilles tendon. You can see the Achilles tendon right here and here. And we want to take a look and see if it's straight. Now, when someone has severe pronation, and I'll show you what pronation is in a little bit, his pronation is not too bad. But when you have severe pronation, what you'll see is you'll see a bow in the Achilles tendon. It'll actually bow a little bit towards the inside. Now, let me have you separate your feet out a little bit. That's good. And what we're going to look for is the arch right in here. Now, if he collapses his foot, I want you to let it roll. No, just leave it right there. Leave it right there. And just let your foot relax. But if this starts to roll in, if the arch starts to really roll in, then what will happen is this will make this even bow anymore. And that puts a lot of stress on this joint right here, the ankle joint, which is made up of basically the fibula on the outside and the tibia bone and then the talus bone in the middle. And that gives you the support, or basically the ankle mortise as it's called. But when you run, what happens is you get this exaggeration taking place right on the inside. We're going to move the camera around a little bit so you can see it a little bit better. There you go. You can see his foot, on his left foot there, how flat it is. And if you were to give him a normal foot, I'm going to raise it up a little bit. No, let your foot stay on the floor. Let it fly, let it relax. That's good. I'm just going to let the arch come up a little bit. There we go. All right. That's what an arch should look like in a normal foot. Now I want you to let your foot go back to where it was before. There you go. And separate them for me again. That's good. Now we're going to raise this up a little bit right there. That's good. Let it relax. Let it relax. That's good. Now I'm going to bring it back that way. That's good. Yeah, so this arch is what we're looking for. It's not a good arch now, but if he lets his foot just relax, let your foot relax, you can see how it just rolled in. That's flat foot, or that's pronation. And that creates problems because it can cause the knee to rotate. Let me have you turn around. That's good. I'm going to move up to his knees. And what can happen is it can cause the knees to start to roll in and get torsion and stress at the knee joint up in here. And when you get torsion and stress at the knee joint, like right up in here, it can put a lot of stress on the meniscus in the joint and the ligaments here, and it can work its way all the way up to the hip area. So, as I said before, when we looked at Anand's feet, you can see how his foot rolls in. and it's flat. You should have a nice arch on your foot that gives good support to the foot. It's the first shock absorber that you want to have in your body that prevents a lot of the shock from being transferred into the ankle and the knee into the hip area. Now, what we would do for him is basically, because we can't change his feet, we'd put him in an orthotic, and the orthotic is designed like glasses, like he's wearing glasses and like I wear glasses, to basically compensate for the foot problem. And the orthotic will now put the foot in the right position. It'll basically put it into the arch position that you need, into the talus neutral, as we call it, position, and that'll take a lot of stress off his knee and off his hip area and off his lower back by making sure his foot is in the right position every time he walks. So this way, when he goes out running, he won't have to worry about his feet at all. He can just run to his heart's content. So this is Dr. Wolk-Weiss at the Get Well Center located in Bound Brook, New Jersey. And hopefully you'll be out there, if you have flat feet, having someone take a look at them, because if it's creating lower back pain, it is definitely going to be frustrating to get rid of that lower back pain unless you look at your feet. Thanks.
Thank you.